The decades-long opioid epidemic in the US was once dominated by drugs like heroin and oxy. But with the rise of fentanyl, perhaps the most dangerous phase is now upon us. In the first 2 years of the pandemic, more people were killed by fentanyl than ever before. The COVID pandemic helped pave the way for fentanyl's ascent, as isolation and boredom drove people to substance abuse. There have been more than 165,000 opioid deaths since the start of COVID. Most of those deaths involved synthetic opioids like fentanyl. Fentanyl was first developed as a stronger kind of painkiller. It's cheap, and the street version is abundant. It's more than 100 times more powerful than morphine, and 50 times more powerful than heroin. Just 2 milligrams of fentanyl, around the size of a few grains of salt, can cause a fatal overdose. Fentanyl is now infiltrating other kinds of drugs, including heroin and cocaine, as well as counterfeit prescription pills. That means people with an opioid addiction are at risk, and so are users of cocaine, black market Adderall, meth, marijuana, and other substances. A powerful drug is often used to strengthen or stretch stockpiles of other illicit drugs. The precursor chemicals used to make fentanyl are also globally available. According to the Drug Enforcement Administration, a lot of illicit fentanyl is made abroad and smuggled into the US through Mexico. In Florida, Governor Ron DeSantis has described the situation as a problem of law enforcement and border control. He has responded by increasing Florida's penalties for opioid sale and distribution, and he announced a program that connects patients with treatments like naltrexone and methadone to help treat addiction. Similar techniques like syringe exchanges are part of what's known as harm reduction, a movement to decrease the risks associated with drug use. But some harm reduction techniques have been rejected by conservative elected officials, who say they instead enable drug use. Another tactic is the distribution of fentanyl strips, which can be used to test for the powerful substance in other drugs. But the strips are considered illegal drug paraphernalia in about half of US states, including Florida, according to Kaiser Health News. Florida's Republican-controlled legislature recently shut down an effort to change that. In Florida, which skews older and is more than a quarter Hispanic, most of those who are dying of opioid overdoses are white, and more than half are younger than 45. But with fentanyl use on the upswing, the death rate among Black people has overtaken white people, and overdoses among Native Americans are also increasing disproportionately.